My name's Harris. I'm 52. I live in a small village in Kent. I have a number of long-term illnesses. I actually became ill 10 years ago. It started off with vascular problems and it progressed from there to stroke. I had a number of strokes. I suffer from Parkinsonism. I have a very high blood pressure. I'm on quite a lot of medication. I'm not able to get out of bed by myself, so I have to depend solely on carers to get me out of bed. So, my life in that way is very restricted. Once I'm in bed, I can't get out. Most of my needs for day-to-day living are actually done by carers because I'm very restricted to what I can and what I can't do.
Harris uses his budget to cover care visits to his home every day. 2 hours in the morning, 45 minutes at lunch, and 1 hour 45 minutes in late afternoon. Plus, it covers someone to do 3 hours of shopping for him every week and a weekly 6-hour social call.
Prior to personal health budget, I used to be on a thing called social care, which was funded by the local government, which is Kent County Council, and I was on a direct payment with them then.
The funds for Harris's social care package were provided as a direct payment into a separate bank account under his control. This gave Harris choices around how to decide on and pay for the care he wanted.
I'm Claire Morgan and I'm a community matron. My team, we're the long-term condition team. We look after patients with complex long-term conditions at home to try and prevent unnecessary hospital admission. So I've known him for about 3 or 4 years now. He's got telehealth in place, so he monitors all his own blood pressure and blood sugar readings every day, and we visit him once a week just to titrate medication and generally keep an eye on his health.
Harris's health deteriorated around a year ago, and so responsibility for his care shifted to NHS Continuing Healthcare. Harris wanted to retain the sense of control he previously had over his care and finances when he was receiving social care support.
The matron suggested to me that because of my condition, maybe I should be reassessed to see if I could go on to NHS Continual Care. NHS Continual Care didn't actually do direct payment, so Melanie, the continual care nurse, knew of personal healthcare budget, which would enable me to have control of my finance for my care. When I was assessed by the personal healthcare budget team, I was told that a healthcare broker would come and see me, and between two of us, we'll sit down and draw up a care plan as to how and what is the best way for me to get the best care to meet my needs.
This has enabled him to be able to make choices and be involved in his care, and it's given him a whole new kind of outlook, really.
I say to the carer, on a day like this, should we go to Folkestone Beach? And I can go on the beach and sit down there and have a coffee and see the world go by, really, which is better than staying indoors, which I normally do. If I want to go on holidays, I can have a personal carer 24 hours a day. Obviously, for me to have a carer 24 hours a day, the cost is going to be quite high, plus I've got to pay for the board and lodgings for myself as well as the carer. So instead of maybe having 4 weeks, I could probably have a week and a half or 10 days or a decent holiday in UK somewhere, which I never had before. I could go and visit my family in London and maybe stay in hotels and visit them in the evening when they're home. So I've never had a chance to do that, previously.
In the past, Harris was in hospital probably 8 to 10 months of the year, and since the personal health budget, it's enabled him, I think it's empowered him, and it's not all about the illness, and it's given Harris some control over his life. With the illness, he couldn't control it. He has actually now got some control, and that really does impact on his health, and he's been very stable for a while now, and I think it's because he can choose his care package, his care with his hours. I think now he can make a choice. He can have the carers he wants. He can have the times he wants, and it's very, fitted around how his day is, and it takes the stress away from him when it's working well. So I feel giving him this empowerment through the choice of care package has greatly improved his health.
If my care package needs to be increased because of deterioration of my health or anything like that, it is automatically assessed and readjusted to meet my needs.